the EEOC, in case anybody is unfamiliar, is the entity here in the U.S. at the federal level called the Equal Employment Opportunity Commission, and it receives charges of discrimination and harassment each year based on alleged violations of the federal statutes that protect against discrimination in the workplace, including disability discrimination under the federal law, which is called the Americans with Disabilities Act. They have a certain budget to take on certain cases that the EEOC can litigate on behalf of individuals every year. And typically, I think last year they were able to litigate about 90 cases. 1/3 of those were disability-related cases. So it just goes to show that when they have a limited budget to apply, they are focusing 1/3 of that budget on that one specific protected class of disability. And we are also seeing from the data that mental health claims there's a significant uptick, particularly around anxiety, PTSD, depression, and bipolar disorder related claims that we are seeing, and the impact on how people feel that they're being treated in the workplace when they have those conditions. There's a recent study that came out from Mindshare Partners, which is a nonprofit that surveyed 1,500 individuals. So obviously it's not the entire country, we can't speak to it, but it is a representative sample. And similar to what Rachel was saying, I think this kind of follows directly based on that survey. 76% of the people surveyed were saying that they had experienced at least one symptom of a mental health condition in the past year, and that was up from 59% in 2019. So this study was done, I believe, in 2021. So again, the data continues into 2022. We'll get to that in a moment. But it's not surprising that there was an uptick in these reports, particularly based on the pandemic and this kind of unprecedented life experience that the entire world just lived through together. And another very important finding I thought from this report was that the symptoms that people were experiencing were also lasting longer than mental health experiences that they had or mental illness experiences that they had previously. Burnout, as Rachel was mentioning, was the number one. There it is. Again, not surprising because everyone was trying to figure out every single day, how do I do my job while I'm at home? I'm never sure if I'm going to be able to go out again. Are there going to be groceries? Did I Lysol the box that just got delivered? My kids are, trying to be homeschooled while I'm trying to work. It's not a surprise at all that burnout, depression, and anxiety came in the top three. And I thought it was also very telling that these symptoms were felt most powerfully at the senior levels of employee organizations, of course, at every other level as well. But on top of the fact that the whole world was going through this, executives and companies were also trying to figure out how to keep the lights on, how to continue being able to pay their employees and allow them to continue to have their safety and hopefully job security during this unbelievably unknown, uncertain period. So it's not surprising that symptoms were felt most so at the executive and C-suite level, but of course as well by all other levels of management and individual contributors as well. And as Rachel said, of course, these things are going to have a negative impact on focus, productivity, efficiency, responsiveness. Of course it is, right? We're all human, and these things we were all collectively experiencing. So a lot of the types of things that we were seeing in terms of how this played out in employee experience was that people were feeling very stressed. They were feeling overwhelmed. They were having trouble kind of focusing or, being really integrated into what they were supposed to be doing. They were, especially because they were home, they were not feeling recognized. It's a lot harder to feel appreciated and recognized over Zoom, during the 10 minutes that you have your department call a week, as opposed to being in the office every day. And so people were feeling that there was less communication, less recognition. And what's going to happen when these things are going on for a sustained period of time, you're going to have employees kind of leaning out, feeling disaffected, and then maybe feel that they should look for another job, or feeling that their jobs are not secure. So these were all kind of interacting factors that were happening at the same time.
And Jessica, just briefly to jump in, I'm curious if you found, I've heard a lot, in my line of work with recruitment, I hear a lot of people talk about reasons they want another job or don't want another job. And the question of being boundaryless and not having an end to your workday because there is no commute, because your desk is your bed, is your kitchen table. What have you found about that in terms of burnout? Has that been something that employees have pointed to as being a positive development and that they have latitude to work from home, or actually a challenge, or is it a mixed bag?
Yeah, it's a really great question. And I don't know, others, I'd love to hear from Nathan and Rachel on this as well. But for our clients, it's definitely been both sides of the coin. And you'll see as we get into the next survey, but I can talk about it now. In some ways, the remote work experience actually, especially with regard to historically underrepresented groups of employees at companies, actually felt more comfortable and more positive and less mental health strain during the pandemic, because certain populations of our employees were more concerned that when they went to work every day, they were going to be subjected, or more likely to be subjected, to microaggressions or harassment or discrimination. And when they didn't have to go to work and they didn't have to interact as often in person with their colleagues, they actually were feeling more positive because they weren't exposed to those things, or they weren't as fearful that they would be exposed to those things. So that was kind of an unanticipated positive of this. On the flip side, I mean, I can tell you from personal experience, I was afraid to go to sleep for several months at the beginning of the pandemic, because we work with clients all over the world, and there were so many developments at the federal, state, and local level literally every day that I was, no matter what block of time I tried to go to sleep in, I would be behind when I woke up because something changed, whether it was in Asia or California or anywhere in between. So, and I remember, like, specifically during that period, one night it was like 7:30 or 8 o'clock at night. And I'm like, I need to feed my children. I have not fed my children. I need to stand up and walk away from this computer and go feed my children. And then I will come back to it afterwards and get whatever it was done that I was doing. But you get so into it, and you're right, there was never a start or an end time to the day. It was just go for many times. So I think most people felt somewhere in between, and felt a little bit of all of that, depending on the day, especially during that time. Now it's leveled out a little bit. We're also seeing a pendulum swing, of course, because of the economy right now, whereas during 2022, there was, I think, a pendulum swinging very much in favor of employees, because there were, bodies needed to do the work. So the employees or applicants for jobs had more of a say in the work-life conditions that they were willing to work in. And, for companies that wanted people back in the office, last year we were seeing a lot of clients who said that the applicants were like, if you won't let me work remotely, I'll go find somewhere else who will. And companies then didn't have the bodies to do the work. Now, with the economy changing this year, it's kind of swinging back in the other direction, and employers we're seeing more ability to say, no, we need you in the office, 3 days a week, or even 5 days a week in some industries. And that's how it's going to be. And because of the downturn in the economy and layoffs, people are needing the job security. And so the pendulum swings. It's always a back and forth in my world. I don't know, Nathan and Rachel, if you're seeing the same.
Yeah, it is. Hi, thanks everybody. Great comments, Jess. It is definitively a pendulum, and it's swinging, relatively hard towards the, more recessionary environment, so that the employer has, some more leverage. And I think employers have 100% woken up to the importance of workplace mental health. From the pandemic. Some leading employers were ahead of the curve already, and we're focused on providing programs and skill training for managers and resources for employees as, sufferers of a mental health issue or caretakers. But pretty much everybody woke up during COVID, which is great. But right now they're just also being constrained by budget dollars. Their revenues are challenged, their profitability is challenged, worries about being further challenged. So we see, in the nonprofits I'm involved with, and some of the workplace mental health for-profit companies I'm invested in, like, they're having a harder time meeting their commitments this year, and budgeting for next year is also down. So that just means, people who care, like a lot of the people I'm assuming on the phone, self-selecting group, we have more work cut out for us to be leaders, to ensure that, our colleagues are aware of the resources that are available. And I don't think the mindset has changed in senior leadership of these organizations that are cutting budgets at all. I think they know that it's critically important. They're just challenged and have to cut from somewhere.
Yeah, it's a really difficult time for sure. Thank you for jumping in there. I wanted to touch quickly on the Workforce Institute study that came out in an article by Forbes in late January, particularly for any of you on the phone who are executives or in managerial positions in your organizations, because I think this is also very telling. And in fact, I've been giving a lot of manager trainings lately to many of the managers at our clients, because they are kind of line one, when an employee has a concern or wants to disclose something, if they have a good relationship with their manager, which is the goal if you're a good manager, you're going to be the first stop as a manager when somebody wants to disclose something, or often where it most often comes up is, in response to performance feedback or critical feedback. And we had no idea when we hired this person, or even in the 3 years they've worked here, that they have any kind of diagnosis. But then we give them a poor performance rating or a performance warning, and then in response we hear that in fact, I think it's because I have ADHD, or because I have this, insert here condition that I'm having more trouble meeting this executive function piece of my work, for example. And so managers are always going to have a very, very strong, and in fact, probably the strongest, in my opinion, impact on the mental health of their direct reports. And this study absolutely bore that out. This was a study of about 3,400 people across 10 countries. But they said for almost 70% of the people surveyed, their manager had more impact on their mental health than even their significant other or even their doctors or therapists. And I found that very interesting. And so when I'm talking to the managers and training them, we always remind them how important it is to think before they speak and try to do their best to make sure that what they're saying and what the employees are hearing is the same thing, because everybody, of course, receives information through their own lens of their own life experience. But that critical importance of taking the time to be thoughtful in all of your communications and your feedback, I can't emphasize that enough, particularly given the impact that managers clearly have on mental well-being of direct reports.
And if I can interrupt just for a second, Jessica, because something you said harkened back to a comment that Rachel made earlier. Rachel spoke about non-clinician diagnosing, and I've often heard the phrase, I have an honorary PhD or an honorary MD from Google University. Like, I don't actually know what the DSM requirements are for something, but that person seems to have this condition to me.
Oh.
I think an interesting question is when you have employers who want to support employees who may have or who are demonstrating symptoms or conditions or behavior that aligns with a possible mental health issue on the one hand, and on the other hand, it's an invisible disability that may not be disclosed. What are some tips for employers who want to support people but also don't know if they have a condition or not? When you're supporting behavior or scaffolding without knowing of a disclosed disability.
Yeah, it's a great question, and we'll definitely touch on that as we go through the slides on the interactive process as we move forward. But in short, it can be very, very tricky and one of the hardest things to navigate as a company and as a manager, because you can have very well-meaning managers who notice that something seems off or not, somebody's not acting as they typically act. And with the purest of intentions and care for their employee, they may go up to that person and say, you seem off, or something seems wrong, or you don't seem yourself. And then that employee turns around, and we've had this happen at various clients, and brings a claim for perceived disability discrimination because the manager said that to them, even though the manager was trying to take care of them. So we always have to try to find balance between what we're thinking and how we communicate that. And so what we often say is, I've gotten calls from HR before, so an executive said that so-and-so is acting drunk or seems high, or, we have to be very, very careful. We don't want to make assumptions about anyone. I even had a call once where somebody smelled like they had alcohol on their breath. Their breath smelled like alcohol. It's because they were a diabetic. I am not a doctor, but from what I understand, sometimes because of the way diabetic people metabolize things, they might have a breath that smells alcoholic, but they were not, and then that made that person very uncomfortable because somebody said something stupid to them that they weren't thinking about. So we have to navigate that very carefully, and we have to make sure that our that we have HR professionals in the organization that are equipped to assist with those kinds of conversations and initiate those kinds of conversations with the employees who we believe may have that kind of condition in order to support them properly. Because the last thing you want is a decision maker here, a manager or direct, leader of somebody, saying something and giving the impression to the employee that we're taking any health condition they might have into account when that decision maker is making decisions about promotions or, you know, anything else, title, raises, assignments, anything. So we have to be very, very careful. We will get into that more as we move on through the deck. So I just want to make sure to move on so we get through everything. The caregivers, if you just look very quickly at the statistics, not surprising, are more likely to give up their jobs to support mental health than non-caregivers. The data also showed that generationally, there's a difference in the generations of employees who are more willing to give up high-paying jobs to support mental health as well. As I mentioned earlier, there was this kind of unanticipated improvement for certain historically underrepresented groups who felt more comfortable and felt less stress and less mental health strain during the pandemic, according to this study, because they were not in person and not as concerned on a daily basis of facing microaggressions or harassment or discrimination in the office. And generationally, there were, and caregiver-wise and gender-wise, and the data also showed that certain categories of employees are more likely to feel comfortable reporting mental health symptoms, to talking about it, and have even made moves job-wise because of mental health to support their and protect their mental health. But what was very telling from this survey, and I think from Rachel's stats as well, and from the feedback that she was giving, is that while many people felt more comfortable speaking up and talking about it and trying to destigmatize it, many of them said it was not a positive experience when they had the courage to do so. So here we all are, like, this is why we have a lot of work to do on an ongoing basis as organizations. And I have been talking, you know, for months and months and months about this, and here we are in Mental Health Awareness Month, so I'm going to say it again until I'm blue in the face. But this is not just like a nice to have conversation if we get to it so we can pat ourselves on the back that we did something during Mental Health Awareness Month. These topics, this topic we're talking about today, is so critical to every component of a company's success in this moment, and frankly, always, because you cannot talk about, or you cannot succeed in your DEI efforts or your employee retention and development efforts without also very carefully making sure that we're supporting our employees in the way that they need, which is often on a very individualized basis, because everybody's health condition is always going to be on a very individualized, unique basis. So we collectively have a lot of work to do.